Welcome and thanks for joining us on the One Love, Wellbeing and Lifestyle Show, which is filmed in the Harmony Mountain Institute for Living in Pennsylvania. I'm your host, Julia Brown, and Dr. Peter Amato. Great day to be alive.
It certainly is, Miss Brown. It certainly is.
Okay, you're going to be having a special guest today. We've had him on several shows, but due to the vast knowledge that he has, and he's Dr. Gerald Smith. He has a wealth of information. We could just not have done a couple shows with him. We had to do more. So, Dr. Peter Amato, tell us about Dr. Gerald Smith.
Well, as you know, Julia, we've been fascinated with his acumen toward medicine, health, and healing. Dr. Smith started off many years ago as a regular dentist, folks, and over the years he became more curious. He saw so many things going wrong with people, and he began to reach out and study and take certifications and went back to school to become a holistic health practitioner. Today, he calls what makes us sick our splinters. And basically, it's the roots of our problems. And he has learned how to identify the symptoms as well as the roots of problems. And he's had amazing success over the years with most all diseases in helping people basically eradicate and eliminate disease, if not the symptoms for sure, even in pain management, cancer, diabetes, and everything else. So we're honored to have him back again today, and we'll take a break, and we'll be right back with Dr. Gerald Smith. Okay, folks, welcome back to the Wellbeing and Lifestyle Show. I'm Dr. Amato with the famous Julia Brown, all the way from St. Martin in the Caribbean. And we have today with us Dr. Gerry Smith. We're going to talk to you today about a few topics. We're going to tee it up with a few topics to talk about dizziness and migraine headaches. I think so many of us can identify with those ailments in our lifetime. If not, we certainly have friends or family members that have problems like this. Dr. Smith, talk to us about these issues and concerns we have amongst many of the population.
Sure. Dizziness is really an incapacitating malady or illness. We had one patient, it was very interesting, suffered 15 years with vertigo. He went to Johns Hopkins, he went to Hershey Medical, and they basically put him on a migraine diet. He says, I don't have a migraine. Anyway, as usual, when they run out of conventional options, he wound up on my doorstep. And when I examined him, he had a root canal on the second molar tooth on the lower left side of his jaw. And in that tooth was cytomegalovirus. That virus then had migrated to his left ear from the tooth on the left side. It was in his inner ear. And so, Johns Hopkins told him that he had a virus, but they couldn't pinpoint it. In 5 seconds, I diagnosed it with my quantum testing technology. And he had purchased a Rife machine, and the Rife machine is technology that was developed in the 30s and unfortunately was all suppressed because you can get rid of pathogens and viruses without drugs. In 2 months, his vertigo completely resolved because the infection was under control from the frequencies. The only thing that'll get inside a root canal tooth, which is a dead organ, is frequencies. You could take homeopathics, you could take vitamins, you could take herbs, but they can't get inside the tooth because it's dead. There's no circulation. But a frequency literally will go through a brick wall. So the frequencies killed the virus, not only in the tooth, but also in the inner ear, the left area. And he had total freedom back to normalcy. And that's kind of like really exciting to take somebody who's been incapacitated for 15 years and you flip them around in 2 months without drugs.
Wow.
Yeah. So that's kind of exciting path that I've been on this journey. And the other big incapacitating issue is migraines. I mean, I don't see the person that had a migraine for a week. We had one young woman flew in from Tobago, 20 years migraines. She had 3 concussions two concussions and 3 whiplash injuries. She's been to all the, quote, headache specialty centers around the country and elsewhere. Nobody could get to first base. Her cranium was distorted from the traumas.
Where's the cranium?
Your skull, basically.
Okay.
Oh, okay.
And the base of her skull, instead of going into flexion, went into extension. So December, it'll be 3 years. When she came in, I evaluated her. I said, your cranium's out of sync with your breathing mechanism. I adjusted her skull. The migraine disappeared totally. Wow. Also of interest, she had triggers. So one of her big triggers was alcohol. And after I treated her liver with nutrients to detox it, you could, listen to her video testimonial on my website. The alcohol is no more a trigger. So the key in the equation is when someone tells you that alcohol or other medication cause you problems, invariably it's the detox mechanism, the liver, that's not working properly. When I detoxed it, gave it the right nutrients, when she drank alcohol, it broke it down and didn't trigger off the migraine. So she had two components, a liver issue and a structural issue. So again, gets back to my mantra, define the splinter, define the core issue. Resolve it, the symptoms disappear.
And how long you said this took from the time you had her until she was completely healed?
Well, it was one treatment to adjust the cranium and 6 weeks later on nutritional therapy that resolved the liver problem.
Wow, that's impressive. After having this for 20 years.
Yeah.
Over 20 years.
Yeah.
Wow.
And that's fascinating. You were able to tie the liver to the problem resulting from the alcohol.
Yeah, I mean, the liver is your main filter in the body.
I see.
And the key in the equation is that if you have a patient that needs dental work done, for example, mercury fillings removed, and you don't prepare the liver to handle the dumping of the mercury, it just recirculates into other tissues and organs of the body, and that's why these people get sick.
Fascinating.
Yeah.
All right. Well, we're learning so much today with Dr. Smith. We're going to take a break here with One Love, and we'll be right back with Julia Brown.
And welcome back to the One Love Wellbeing and Lifestyle Show. I'm your host, Julia Brown, with Dr. Peter Amato as my co-host, and of course, the very famous Dr. Gerald Smith. Welcome back, sir. And before we go on the break, he had a wealth of information to share with us, and he's going to continue because this information that he's imparting, it's very relevant to today's world.
Well, thank you. I know one of the big problems that you mentioned on the island is diabetes, and we recently had an 8-year-old that was diagnosed with type 1 diabetes, and I tracked it down to the MMR vaccine that he had. These vaccines are really dangerous, and the measles and mumps issue got actually trapped into his pancreas. And, traditional medicine, they don't know that they don't know. He also had some cadmium trapped in his pancreas. Well, the long and short of it is I put him on appropriate nutrients to detox the cadmium and also to restore the function of the pancreas, and his blood sugar started to drop precipitously, and the doctors couldn't understand why he was changing so fast, because we were pulling out the offending splinters, which was the MMR vaccine. You use what they call homeopathic nosode. That's a homeopathic remedy that's literally developed from the vaccine, like cures like. So if, for example, you have poison ivy and you take Rustox, which is a homeopathic form of poison ivy, the itching and the vesicles will disappear within a couple of days. So we do the same things with vaccines. We have companies that make up special nosodes of specific substances. In this case, it was MMR vaccine, and the child did, dramatically well. And so this is the key, define the underlying problem. We had one woman that had, I think, 24 years of rheumatoid arthritis. Mm-hmm. They had her on methotrexate, they had her on steroids, and they had her on Enbrel, which was a drug that cost $13,500 a year on one medication. In fact, her husband couldn't even afford to retire because he'd lose his medical benefits. Sure. And, guess what, people? I tracked it down to a root canal tooth. At age 29, the upper left lateral incisor in the front had root canal. At age 30, she developed severe rheumatoid arthritis in her knees, and then it progressed. So when I saw her, I looked at the x-rays, and they all looked pristine, even the root canal tooth. But energetically, she had strep viridans in the root canal tooth. The same strep was in her joints where she had the rheumatoid arthritis. So we put her on frequency machines, we put her on nutrients, and guess what? The arthritis disappeared.
Of course.
Wow.
Yeah.
Over what period of time would you say?
Probably about 12 weeks.
That's amazing.
Yeah.
That rapid, we can see results with the proper nutrition and frequency.
Yeah, in fact, we had another case of severe rheumatoid arthritis where the fellow contacted me from Budapest, Hungary. Whoa. And in fact, the funny thing was, he said his wife's been in bed, and when she walks, she has to have crutches. She's on severe pain medication. Been to all the top specialists in Europe. They couldn't figure it out. My first question, I said, does your wife have any root canal teeth? He said, yes, she had 3 of them. I said, she's got infections that are feeding the joints. So he bought a Rife machine from us. We shipped it over. And in 6 months later, I get an email. My wife is walking without crutches, has no more pain, no more medication, and no more rheumatoid arthritis. It was coming from the root canal teeth.
Wow.
Yeah.
But I was reading also from the website, because it's just a wealth of information on that site, where I saw you actually like reversed cancer.
Well, let's put it this way. It's a side effect.
Okay.
So basically, if you remove the splinters, the cells want to go back to normal. For example, we had a retired dentist who had basal cell carcinoma on the side of her nose. And for a year, she did, all the right things, wheatgrass juice, coffee enemas, organic food, meditation, but it didn't solve the problem. So as usual, they wind up on my doorstep, and I diagnosed that she literally had mercury in the cancerous lesion. So we did a detox. She went through 3 major waves of detox. I have photographs of it. When I lecture, I show it. She had a red rash over where her thyroid was and rashes over her chest. She literally, Peter, wanted to jump out of her skin.
Wow.
The key was that when the toxicity starts to come out through the skin, it causes itching. Mm-hmm. So we went through 3 waves of this detox process. At the end of a year and 3 months, the cancer disappeared because we removed the splinter from the lesion.
We're talking without chemo. We're talking
no
without
chemo,
radiation, without...
Nothing. That's it. Just plain common sense. As my grandmother said, common sense has to be learned.
Right. And Dr. Smith, how do you decide on how to go about the detoxification protocol when you find a melanoma with mercury on the face?
The same process. You just have to think logically. If you get a lot of dust in your house, you change the filter, right?
Right.
In your heating system.
Sure.
Well, what's your filter in your body? It's your liver. So the first thing that you got to do is clean the liver out. And there's specific nutrients that the liver needs. Once you get that cleaned out, then you move on to homeopathic remedies to increase the drainage. Then you go after the heavy metals. Then you go after the chemicals. Then you go after the infections. And the last thing you do is go after the vaccines. If you follow this protocol, which only took me 35 years to connect the dots on, you get less Herxheimer reactions, adverse reactions, less, bad effects from the detox program. You prepare the filter, clean it out. Then when you start pulling the mercury out of the skin tissue, the liver can handle it, puts it into the bile, out it goes through the feces.
Right.
That's how you handle it.
Okay. So the liver, I'm sure the gallbladder.
Right. The kidneys.
Kidneys.
The skin, the lungs.
Right.
And then the drainage.
Large intestine.
Exactly. And then you go after the heavy metals, the chemicals, the infection, and then the vaccines. That's the sequence that we follow.
Wow. So you've got an actual clinical protocol that is somewhat of a roadmap.
Absolutely.
And that's very interesting. I think we want to maybe talk more about that in the next segment, the clinical protocol and the roadmap, because I'm sure we have some other healthcare practitioners in the audience that may want to know a little bit more in depth about how Dr. Smith goes about it.
Oh, yes. That would be interesting. So we will definitely come back and hear much, much more when we come back right after this break.
Okay, we're back, folks, with Dr. Gerald Smith. On the break, we were talking about somewhat of a clinical protocol. In other words, a roadmap. There's ways that Dr. Smith knows, and most all practitioners, that goes through some type of organized way of bringing us back to optimum health by removing the splinters, the symptoms. And I'm understanding that if it's not done in a certain way, the value is not as recognized as if it was done in a specific way. So we're going to ask him to talk more about how he thinks that through and why this before that and so on.
Okay, a perfect example that will illustrate this. We had a young woman, 29 years old, who was going blind. They had her on steroids. And the parents brought the daughter in, and when I did my energetic testing, she had cytomegalovirus in both her eyes. Well, the virus, when it's metabolizing, is producing toxins, and it clouds up the vitreous humor in the eye, so you start losing your sight. So the first thing we had to do, I defined the problem. Now we have to define the protocol to unravel this problem. We first clean out the liver, and the liver needs glutathione. It's a very powerful antioxidant. It's a tripeptide amino acid. It also needs SOD, superoxide dismutase. Pomegranate is high in SOD. Chakra mushrooms, chaga, is high in SOD. So we test the patient to see which formula of glutathione works best for her, because we have 4 manufacturers that make glutathione. But sometimes only one formula has the right energy pattern that matches the patient. We just don't shotgun a product off the shelf and give it to the patient. We test everything with each patient. The same thing with the SOD. Also, we look at curcumin, which is the active component of turmeric. So we test to see which brand works the best. We also look at some liver nano detox, which is a premier research product, very good. Then we look at milk thistle, which helps the liver to regenerate, not degenerate, but regenerate the hepatic or liver cells. Once we get the filter addressed, and we do it sequentially. You can't take all these supplements at once. You're going to wreak havoc in the body. It's too much chemistry all at once. So I test to see what's the length of time on these supplements that the liver needs. Could be 1 week, 4 days, 5 days, 2 weeks, 2 months. Every case is different. So the patient follows the protocol. If it's 6 weeks, they take only those supplements for the liver for 6 weeks. Then we test one of 9 homeopathic remedies for drainage. So when we get the right one, we test optimal minimal dose. Optimal minimal dose, very important. You just don't shotgun standard dosages.
Okay, so we detox, then we drain.
Then we drain. So once we get the drainage, they add that on to the supplements that they're taking for the liver. So you're building this whole protocol. And again, it could be 4 days, 5 days, a week, 10 days, whatever. Once they finish that, then we test for the best chelating agent for the heavy metals. And in my clinical experience, there's a product called Platinum Plus, which is an amino acid product. Fantastic. It's natural. It has sulfur double bonds, grabs onto all the heavy metals, not just mercury or cadmium, but all of them. So then we add that into the mix. So now you're taking all the supplements for the liver. You're taking the one drainage remedy for the drainage process, and then you're taking the one supplement for the detox. And then we also test for the clay, because you want to take clay to grab onto the metal in the intestine so it doesn't get absorbed back into the liver and in the circulation. The next process is chemicals. We find a lot of pesticides in people today, especially Roundup, glyphosate, very toxic. I mean, it makes DDT look like it was Kool-Aid, literally.
But the folks in the Caribbean know what Roundup is.
Roundup, it's a weed killer. And they also spray it on crops as a dehydrating agent before they harvest. It's a pure poison. I'm telling you, it wreaks havoc with cancers, you name it, with all kinds of medical problems. All documented. It's not maybe if.
And when they spray for bugs, same issue?
Absolutely. It's lunacy on steroids.
Oh my goodness.
So now we want to address the pesticides. And there's a great product called isophenolic rings that Energetics puts out. And it's a wonderful product. And again, you have to test the right dosage. Once you get the dosage for the chemicals and you finish that process, you move on to the infections. The reasoning is real simple. You have to take the burden off the immune system and the filter system so that the immune system can 100%, 90% go after the pathogens. If you have a weak immune system, you kill the pathogens, the bugs come back. So what have you done?
Right.
It's like painting on rust. It looks good for a while, but it doesn't solve the problem. So then once we get the infection under control, then we go after the vaccines because they're the toughest to get out of the body. Those chemicals get locked into the tissue. But with a clean liver, great drainage, low burden of mercury, decreased chemical burden, now the system is humming like a Ferrari. And it can really address the vaccine issue.
Right.
And we get unbelievable results. That's the whole key.
And how do you get those vaccinations out?
With homeopathic nosodes.
Homeopathic products.
Yeah, homeopathic products. Like cures like. There's many different products out there. Again, we test, or if need be, we literally test to see what potency. See, homeopathics can have like a 1X, a 5X, a 12X,
okay,
a 30C, a 1M, whatever. We test to see what potency their body needs to extract it.
Right.
And then if need be, we have a company that makes a custom nosode for us, and then we, of course, give it to the patient. You just can't willy-nilly throw products at people and expect to get great results.
Right.
It's custom.
Right.
Everything's custom.
That's
And
amazing.
this is all done with your machinery that you have?
You can imprint, you can make custom remedies, but in certain cases we have to have them made up.
Okay.
Yeah.
All right. Just wanted to
Sure.
find the difference with that.
But I think what you're suggesting is that all of this is done with personalized testing to find the uniqueness and the exactness of the product and the dosage.
Yes, it's no canned, one-size-fits-all process.
Right.
And we treat every patient like they're an individual, which they are. And we give them time. I spend an hour with my patient that first visit, and on subsequent visits, I don't run a numbers game because you can't. You can't adequately assess the history and what's going on in a patient in 3 minutes. I mean, that's ludicrous.
Exactly. Like in our office. All right. This is beautiful stuff. Great work being done here. We're learning a lot, and we're going to take a break here, and we'll be right back with more of One Love with Jerry Smith. Okay, folks. Well, we're out of time for today with One Love, and we've had quite an amazing show with Dr. Gerald Smith from Pennsylvania, and how he's taken dentistry all the way to eliminating disease. One Love. We'll see you next time. Thank you, Dr. Smith. Thank you, Ms. Brown.
Sure.
Cheers.
Thank you.
Thank you.